Hello and welcome to HIMSS TV. I'm Susan Morse, Managing Editor for Healthcare Finance News. I am here today with Chris Gervais, Chief Technology Officer for Kairos, and Mark Menton, General Manager for HealthSpark. Chris, would you like to start first? Tell us a little bit about Kairos and what you do there.
Sure. So Kairos is about 11 years old, and we were founded to solve the problem of helping to match patients with the right provider. So our co-founder, Graham Gardner, who was a practicing cardiologist, was really experiencing this problem of getting patients who he couldn't help. And so he really wanted to figure out how to address this more systematically and started Kairos. And through that, we rolled out a provider data management system into the market as part of a first wave of easing patient access. We got to make the stuff that patients want to find easier to find. And better described. And then we started to add some applications on that for enterprise call centers and access centers. But the place that really taken off has been consumers. So enabling consumers to find a doctor and find care digitally much easier. And then over the last 5 years, what we've really been focused on is the last mile of the journey, which is self-service scheduling for patients. So patients can really find that right care and schedule it as easily as possible. And then we've worked with our health system customers to strengthen the core directory, make that information more complete so that patients can make a more confident choice in their care, and then help them radiate that out to all the different places that patients are seeking care, whether they're looking in Google, so you want to be at the top of the Google search results. A lot of our customers are investing in different service line mobile applications, and we can be embedded in that. And so again, we're really focused on helping this journey with our customers to get patients matched to the right care, and then help our customers also manage all the providers and care options that they have in as dynamic nature as they can so that that match can be taken care of as quick as possible. I play the role of Chief Technology Officer. I'm very, very happy to serve there, and I get to work on a number of things with our product development teams, as well as business development and with our sales and marketing teams as we seek to engage with our customers.
Thank you. Mark, would you like to do the same for yourself and HealthSpark, please?
Absolutely. And I think the first thing is HealthSpark is a Kairos company. So that's it. While we have separate brands, and we're all in the same family. And that actually happened in April of this year, where we announced the joining of forces. Kairos acquired HealthSpark. And what HealthSpark does is we provide guidance for health plan members. So Graham and I, when we first started talking about this joining of forces, it felt like two companies that were born out of the same DNA. Trying to solve similar problems, just attacking it from different angles. Kairos on the health system side and HealthSpark on the health plan side. So we were actually formed within a health plan in the Pacific Northwest with the idea that people had the right to access information to make smarter healthcare choices. So that was not only is my doctor and network, but pioneers in price transparency, understanding how much it's going to cost both in total, but also my member out of pocket. Like, what does it mean to me personally? We were the first to market with patient review. So allowing patients to explain, this is the experience I had in the provider's office, and publishing that information. So we were leaders in that, going back to the mid to late 2000s, before price transparency and some of the social aspect was even thought of widely. And we serve over 55 health plans across the country on member guidance. And again, it's very similar to what Chris said. We're trying to help people find the right provider at the right time to access the right care. And what I do as general manager, basically I lead the go-to-market function of HealthSpark. So I work with our sales, marketing, and delivery teams to ensure that we're driving value for our health plan clients.
Okay, thank you. I have to ask, are you both working together with payers and providers to bring them together to work on solutions that meet the demands of both?
100%. That's actually the way we first came together, as we had common clients that there was a health plan and a health system that were under the same umbrella, and there's a number of those across the country. But that was we started working together as partners and realized there's a lot of potential here, and let's put these two things together and see what happens. And the early results are pretty powerful. When we think about members accessing care, if you think about data, so we talk about incorrect data, or data is different from the health system versus the health plan. And we've taken data from multiple health systems, integrated that into the health plan's website, and we're able to update 80% of their doctors' profiles with more accurate, up-to-date information around philosophies of care, education, training. But probably most impactful is languages spoken. We added 49% of the doctors, we added languages spoken to their profile that made them available and searchable for members that might have spoken Mandarin or Spanish, where before they had little to no access, or they thought they did because the data didn't support it. And then over half the doctors added that. So we absolutely understand and have a fundamental belief that bringing that data together and making sure that the right data shows up at the right time is foundational to building trust and helping people get to the right provider.
Absolutely. And you know, both health systems and payers are, you know, really organized these days around seamless access, convenient access for patients, for members. And as Mark articulated, when we looked across the table at each other, for us to bring these two, you know, at the core, these two data sets together to help patients and members make more confident choices, more complete choices, and then bring our scheduling capabilities over into the payer market, so that not only are the members in their maybe their health plan portal are getting a much richer, more engaging provider directory, they can actually do something about it. They can click the book appointment button, and right from there, book a provider that they know is in network. They can see costs, they can comparison shop easier. And so it's really helping to level up that entire experience.
And of course, patient access and patient experience is huge. And especially with COVID, digital health has skyrocketed. Can you talk about that? What has happened since COVID, and has that aligned with what you're doing as far as how digital health has been affected by the pandemic?
You know, we had already begun prior to COVID as Kairos expanding the types of, you know, the type of care options that patients could engage with and schedule through Kairos on behalf of the health systems that we have as customers. So we had already been expanding into virtual visits, supporting that, which obviously during the pandemic skyrocketed usage with our customers, right? But at the same time too, a lot of health system customers were thinking about, well, how can we mobilize care in different ways and maybe be able to take it out of the traditional four walls and into new delivery mechanisms? Could we bring things to the community, right? Maybe more, you know, mobilized testing facilities, or other types of things just for you know, routine care that could now be brought out to the community. The problem is letting the community know that it's there and letting them schedule it. And so we worked with a lot of customers to do that, as well as enable scheduling of testing, you know, not just COVID testing, but there are other types of tests you want to get. Save me a spot at a retail clinic. So we integrated retail care. And I think what we've been seeing through the pandemic is just the acceleration of a desire to have more digital inventory online in more different places. But at the same time, the level of dynamism needed to say, well, if you know, through the pandemic, we went through this roller coaster ride of things flaring up and coming back down, being able to shift that traffic around was really important for our customers. And I think we're going to keep living with that, right? This very dynamic nature of care delivery, what can be done from the home to the community, to the, you know, to the inside the four walls of the traditional healthcare system. And being able to have that blended and scalable approach is something that we've invested heavily in for our customers.
Chris, I just want to be clear, when you say online scheduling, is this something patients were doing themselves, making their own scheduling?
Absolutely. Yeah. Doing their own scheduling and have it be real appointments. It wasn't a request for an appointment. It was, you've actually scheduled, it's gone into the EHR. And so the benefit to our customers, you know, from there is clear, but it also meant that downstream workflow could kick off immediately. Text the patient or email them with pre-visit instructions. Here's what to know when you show up. Don't forget to fill out these forms. So the patients can now do more of that process on their own time. And prepare for it, which was really, you know, really a huge benefit. And a lot of the feedback we got was oriented around that.
Excellent. And I imagine the workforce was thankful that maybe it saved them some time on phone calls.
Absolutely, absolutely. And especially because, you know, generally those call centers aren't staffed, you know, later at night, or they are for only emergencies. And we saw in our data, you know, through the pandemic, certainly, the number of folks booking appointments after 8 o'clock at night was, you know, really took off because folks were able to actually do stuff on their own schedules.
Provider directories. I know that for health insurers, this is a challenge. So how does having this partnership between providers and payers help with provider directories, getting them accurate? You've already talked about being able to add the language so that patients can log into the to the best person for their care. How else has that helped?
Well, I think timeliness of data and accuracy of data are two key components. And on the health system side, they're touching that data on a daily basis, where the health plan might do it on a credentialing basis, once every 2 years. So I think when you take the timeliness and the accuracy that the health system, because the health system is, if I'm a doctor, I need to have my address right, my phone number right, because I need patients coming in the door. Where the health plan is more about, that's a contract. I need to make sure I send that invoice or my claim payment to the right address. So those addresses might not be the same. So it's really data accuracy and timeliness to me are two of the key things that help with accuracy, but also build trust. Because today we see time and again where, as a consumer of healthcare, I go to the hospital website, I get one answer. I come to the health plan, I get a different answer. Who do I trust? And we typically see the health system gets more trust than the health plan. And so how do we help our health plan clients build that trust up? And timeliness and accuracy, I think, are just foundational.
One of the things that we're able to bring, which I think is going to be very beneficial to members on the health plan side, is, as Kairos, we'd often very much engage with the marketing leadership and the digital leadership at health systems, who are, they very much want to have great photos of the providers, maybe some videos, quick videos, so the patient can really learn about the provider. Some providers have run their own YouTube channels and they want to link to that. And we're able to bring all of that digital content now over and accessible on the plan side, so that the directory matures beyond just a necessary item for compliance, as well as an operational kind of data. It's now really, it can be really used for engagement in new ways. And I think that's what we're really excited to, the bridging of these two worlds with Kairos and HealthSpark coming together. It's not just two products coming together. We're really building a new platform that we think is going to help bridge payers and providers in new ways, and benefit both. And then ultimately, hopefully benefit the patient and the member.
What is the future going to bring, especially if we ever get past this pandemic?
I do think that these digital access points are going to continue to gain traction. Virtual care. I mean, we've got employees that are, when they hear the word PCP, they have no idea. Like, what are you talking about, right? I'm never going to have a PCP. I've got a phone and I can connect with my doctor, or I don't even care who my doctor is. I can connect with somebody right now that will help me. So I think that's kind of an interesting trend we're seeing, both as an employer, but just with health plans, is that people are going to interact with the healthcare system differently. And if you don't provide that ease of access and flexibility, you're going to be left behind.
Yeah, I could agree more. And I think when I think about for the next year, the only prediction I know that will come true is that tomorrow there will be more options for healthcare consumers than there were today. And there'll be more options the day after that and the day after that. And so I think what we'll start to see over the next year, and to use a phrase that Mark used earlier, is a lot of importance is going to be placed on guidance and navigation, right? If there are more options over the next year, it's going to become important to be able to give patients and members better tools to navigate all these different options and to understand when to use them and at what point. So with great power comes great responsibility. And so I think the power to now have all these different primary care options is wonderful. The responsibility now is to help those folks find the one that truly is best for them. And that's where I think, over the next year, we're going to be spending time, and where I think the industry is going to have to spend time as well.
Well, thank you both. Thank you, Chris, Mark. This has been a fantastic conversation. We appreciate you being on HIMSS TV.